Hey guys, my name is Amanda Davidson and this is Kirsten Burwell, and we're both doctors of physical therapy with Direct Performance Physical Therapy in Virginia Beach, Virginia. And we're here today to present on exercise considerations for the pregnant and postpartum athlete. We're both very passionate about this topic, and we feel that it's really important to empower women during this stage in their life to stay active and strong. So we want to give you some ways to do that during this presentation. Unfortunately, the information given to women during pregnancy and postpartum is often very outdated, and sometimes it's just wrong. And historically, there hasn't been a whole lot of research in this realm, but that's really changing. And so it's really important that we get the true information out there and that we implement the research into our clinical practice. We each have 2 children of our own, so we've been through this firsthand, and that has just fueled our passion that much more to dig deeper and find out true information and how to help women with exercise during pregnancy and postpartum. So here we go. So like I mentioned, there are so many questions when it comes to exercise during this time in our lives. And these are just a few of the questions that we've gotten as practitioners and that we had ourselves when we were going through it. Can I run while I'm pregnant? When can I start running again after I've had the baby? Is it normal to have pain while running or afterwards? Should I be holding my abs tight during exercise? Can I keep running even if I'm leaking? And these are saying running, but this is also applicable to lifting, to boot camp class, to CrossFit. Can I keep doing these activities despite symptoms? Is it normal to feel heaviness in the pelvis? And then what are some safe exercises? Or we also get, what are off-limits exercises? So with all these questions, this is just some research just to show the prevalence of urinary incontinence. So, leaking is a big thing that comes into play here. You get questions a lot about that. Leaking, can I still jump rope? Can I still do these activities? And this study showed that 80% of CrossFit participants reported urinary incontinence, and half of them were moderate to severe. So that's just a ton of people. So this is a super common issue. And with all these questions, the difficult thing is most often the answer is it depends. So it's a very individualized treatment plan, and we need to take each woman's symptoms into consideration and their background and their history and develop a treatment plan to get them moving forward. A little bit more prevalent, so 1/3 of adult women in the US suffer from various degrees of pelvic floor dysfunction. So 33%, that's pretty high. There's definitely interventions that we can do to decrease this number. 1 in 7 women ages 18 to 50 have pelvic pain, and about 1/3 also have been found to have prolapse. So again, just emphasizing that these are some common issues, but there are things we can do about them. They are common, but it's not normal, and don't let it be normal for you. So we want to give women ways and tools to help fix these issues. So it's just some research to back up what we're doing here. This study showed that incontinent women have altered pelvic floor muscle contraction patterns. So we'll talk about the pelvic floor in a little more detail in a few minutes, but basically you've got a superficial and a deep layer of muscle. And in this study, it showed that in the continent women, the superficial muscles contracted before the deep. And in the incontinent women, it was reversed. So this just shows that intervening with the pelvic floor musculature can play a part in incontinence. Different types of pelvic floor dysfunction. So you can have urinary dysfunction. You can have different kinds of urinary dysfunction. That urge urinary incontinence is the gotta go. As soon as you feel the urge to pee, you better be at a bathroom or else you're gonna lose it. Stress incontinence, we see a lot with exercise. That's where increases in intra-abdominal pressure contribute to the incontinence. So coughing, sneezing, exercise, jumping, running, laughing, those kinds of things. You can also have mixed, where you have a combination of the two. Painful bladder, urinary hesitancy, so difficulty starting the flow of urine, or incomplete emptying of the bladder are all parts of urinary dysfunction. Anal dysfunction, you can also have, so fecal incontinence or urgency, similar to urinary dysfunction. Also constipation or symptoms of irritable bowel syndrome. Oftentimes these are not thought to be muscular problems, and often there is another component, but sometimes the pelvic floor can play a part in those symptoms. Sexual dysfunction, pain or difficulty with sex can indicate pelvic floor dysfunction. Pelvic pain, whether it's in the groin, SI joint, or the coccyx, which is your tailbone. And then pelvic organ prolapse, so kind of that heaviness, pressure feeling in the pelvis, or feeling that falling out feeling. Quick little anatomy here, just to show the muscles of the pelvic floor. Like I said, there is a superficial layer and a deep layer, but it's also important to note here the proximity of the pelvic floor muscles to the hip musculature, which we'll talk about in the next slide. But hip muscles such as the piriformis, obturator internus, adductors, hamstrings, they all connect very closely, and some have fascial attachments to the pelvic floor. So even sometimes when you're having like nagging hip pain that just won't go away with our traditional orthopedic treatment, it may be necessary to look at the pelvic floor and see how that's functioning. So like I said, the hip consideration. So adductors are your inner thigh muscles, and they do have fascial connections to the pelvic floor. Tightness in these muscles can affect the function of the pelvic floor. Deep hip rotators, which are in the back of our hips, the obturator internus and the piriformis primarily, also have connections to the pelvic floor and can really affect those symptoms. And then hamstrings, of course, the back of our leg, the back of the thighs, they connect to the pelvis. And so if they're truly tight, they could be pulling your pelvis into an alignment that is not optimal for the pelvic floor to function. So normal pelvic floor muscle function. These muscles should be able to change length. They should be able to contract, relax, and bulge or kind of overstretch a little bit. You should have sensation intact bilaterally, be able to sense the deep and the superficial muscle activation. You should be able to hold a pelvic floor contraction for at least 10 seconds. These kind of strength tests are a little bit debatable, but there are some recommendations for returning to running and impact that you could determine on with an internal exam here. But we'll give you some more, some other practical recommendations for returning to running and impact later on in the presentation. And then the biggest thing that we're going to really focus on is the motor control and coordination of the pelvic floor muscles. So oftentimes what we find is that the muscles aren't necessarily weak, but the coordination is poor. And when those muscles aren't coordinated, that's when a lot of times we will have symptoms. And we also want that coordination to be automatic. You don't think about every breath you take. You don't think about every time you blink your eyes. You shouldn't have to think about every time you contract your pelvic floor. But particularly after pregnancy, a lot of that gets disrupted. So we need to retrain it.
Okay, so moving on to pregnancy and exercise. There used to be, you can't do this, you can't do that, you can't do this. Now the guidelines have been changed. Recent research recommends that all pregnant women without other contraindications, which we'll talk a little bit about later, should exercise if at all possible. This includes if you were active before, if you were inactive before, so it's safe to begin exercise even if you weren't active prior to pregnancy when you're pregnant, and even those with gestational diabetes can exercise. That said, you're growing a baby. It starts at the size of a poppy seed and grows to the size of a watermelon, so your body is going through an enormous amount of changes. You're going to have to adapt because of those changes. A pregnant athlete, I don't like to consider them as being disabled, but they are similar to an athlete that I would treat that has an injury, and that we would have to modify and scale in a way that would be appropriate for each individual pregnant person. There are many benefits of exercise. There's decreased weight gain. You're less likely to need a C-section, less likely to have fetal macrosomia, which is a huge baby, decreased risk of postpartum depression, decreased length of first and second stages of labor, decreased risk of gestational diabetes. And I say all of this, this is what the research has shown. That said, you can do absolutely everything right, exercise as much as recommended, and still have these problems. A prime example is Amanda and I both exercised throughout an entire pregnancy, and we both had over 9-pound babies. So this is what the majority says, but you also shouldn't feel bad if you do everything right and something still goes wrong. The baby has a way of showing us very early who's going to be in charge for the rest of your life. So pregnancy is hard. It's like the stuff I'm going to present, I just want to make sure is clear. This is our recommendation, but that does not mean that it's always possible for every pregnant woman, and it 100% means that everybody's pregnancy will be different, and the exercises that you need to do during pregnancy will be different, which is why you can help you with that. The research that had been done did show that the guideline for exercise is to try and get 150 minutes of moderate activity a week. They want you to be active at least 3 times a day, 3 times a week, not 3 times a day, and you want to include aerobic and resistance exercise in that training. So that includes a whole list of things that would be appropriate for you to do while you're pregnant. Let's talk a little bit about the changes you're going through during pregnancy. I'm not going to go in depth with this because your body is going through a ton. But briefly, cardiovascularly, you're experiencing a huge increase in blood volume. Your resting heart rate is increasing a ton. Both of those things are going to make exercise a little bit harder. You're at a higher starting point than you normally are, so you might have a little bit more difficulty. It's going to take a little bit more effort to exercise. Respiratory system, your oxygen consumption increases. I like to point out your diaphragm elevates 4 centimeters, and we'll go into that a little bit later, but that's going to raise everything in this vicinity up. We'll talk about postural changes in a second, but that's part of it. The endocrine system, of course, your hormones are out of control. That's what everyone has known about pregnancy, but that can have a direct effect on how hungry you are. Can you eat? Can you exercise? The gastrointestinal system, lots of changes, not fun ones, delayed gastric emptying that can lead to the nausea, vomiting, heartburn, and constipation that everyone equates with being pregnant, and this can happen right away. So right away, exercise can become difficult. Hematologicals, that's the blood volume is increasing, the red blood cells are increasing, and our biggest focus is on the musculoskeletal system. Your body's changing a ton. You're having an increased body mass, your ab muscles are lengthening, so your core can't be as strong. Those muscles have to lengthen and get a little bit weaker to make room for your baby. Increased lumbar lordosis, the joint laxity becomes a lot more secondary to all the hormonal changes you're going through. The combination of these things with decreased core stability, increased joint laxity, your risk of injury is a lot higher, and it's just something to keep in mind because your body is not as stable as it was. Your center of gravity is also shifting as your pelvis increases in width, and that can throw off your balance. So all things to keep in mind and be careful about as you're exercising throughout pregnancy. All this to say that virtually 100% of pregnant women have some kind of discomfort. 25% of those, the pain is so disabling that they can't, or the pain is so severe it's disabling. And a lot of times your doctor will say, that's part of pregnancy, deal with it. And I hate that because a lot of times there's something we can do to at least make you a little bit more comfortable and be able to do a little bit more activity, even if we can't get rid of the pain completely. Back to a couple of postural changes during pregnancy that I had mentioned. These things are common to occur and will most likely occur to a certain extent, but being aware of them might help us keep them a little bit more under control. So the classic kind of pregnant woman look you think of is like you're leaning back. You see a lot of rib flare, and that can decrease your ability to have core connection. So your rib cage is no longer stacked over your pelvis. Your breathing is altered. You don't have the ability to activate your core and give yourself as much stability as you did before. And same thing with that posterior rib translation. So your rib cage is shifting backwards. It's no longer right over your pelvis. This puts more stress on your pelvic floor, decreases your core stability. If you are aware of those things, it's like we can try to the best of our ability to keep your body a little bit more shifted forward. Keep that rib cage over your pelvis. The last one I see, or of the three that are the most common, is what people call mom butt. You see their butt tucked under. How many times have you heard a mom say they lost their butt during pregnancy and it never came back? Why that happens is you lose your core stability as your abs lengthen. Your pelvic floor is dealing with a lot of extra weight on it, so it's weak. So we go to hold on for dear life with our glutes and your butt tucks under. The problem with that is the pelvis tilts posteriorly, so you no longer have any bony support for your pelvic floor. So you're actually more likely to have the incontinence symptoms, leaking. Your pelvic floor is a lot harder to fire correctly, and your glutes can't fire like they need to. It's like we need your glutes to be strong throughout pregnancy and after. So all things we like to address and try to keep at minimum during pregnancy. There are some contraindications to exercise, and these would be instances where you can't be active during your pregnancy, which is okay. You'll still get back to exercise when you want to afterwards. So some red lights, so these are things that you can't exercise, and that would be unexplained vaginal bleeding, ruptured cervix, triplets or more, preeclampsia or placenta previa after that 28 weeks, also uncontrolled gestational diabetes, hypertension, or thyroid issues. Would unfortunately mean exercise wouldn't be an option during pregnancy. Yellow lights, so these are things that as a physical therapist I would recommend getting an okay from the OBGYN to exercise during pregnancy. If you've had recurrent pregnancy loss, twins after the 28-week mark, gestational hypertension, a history of spontaneous preterm birth, or any malnutrition or eating disorder, we recommend getting an okay from your doctor. Also, during a specific exercise session, you would want to stop exercising if you're experiencing shortness of breath, any regular or painful contractions. So Braxton Hicks contractions do become regular by the end of your pregnancy in many women, but those are not on a regular interval and they're often not painful. If there's a persistent loss of fluid, that could be your water breaking. Please stop exercising and call your doctor. If you have any persistent dizziness or faintness, severe chest pain, vaginal bleeding, stop exercising. And these would be reasons to stop regardless of whether or not you're pregnant. Let's talk a little bit about running while pregnant. We get a lot of questions on this, and you get a lot of conflicting information on whether this is good, bad, horrible, in between. And the answer is some people can do it, some people can't. And it's not necessarily a good or bad. You have to pay attention to your specific symptoms and not compare yourself to somebody else. So as we were talking about, your body's going through a lot of postural changes. So when you're thinking about running, it's a lot of impact on your body when you're not pregnant. But when you are pregnant, you have the decreased stability that we've talked about. Your cadence often decreases. In a runner, or in a pregnant runner or a regular runner, you want to have an increased cadence that decreases the stress to your joints. Pregnancy automatically slows it down, so you're gonna have increased stress to your joints and to your body. These things don't mean you can't run, but it does mean you have to pay extra attention to, are you having pain? Are you having heaviness? Are you having leaking? And if you are, we either need to try intervals, try to scale back, or it might be time to stop. Remembering this is a phase, you will be able to run again. There's lots of alternatives to running, and that can be biking, elliptical, swimming, walking, any kind of resistance and strength training. It's like you want to stay active during your pregnancy, and that is great. Sometimes certain exercises, including running, won't be an option. Sometimes it will, but always keep in mind we're trying to set you up for the best possible postpartum recovery. Here are some other modifications more applicable to kind of the CrossFit world. For a snatch and a clean, the biggest thing we see at different points, usually the snatch sooner than the clean, is your belly becomes a hindrance to the bar. Can you go up and around your belly? Yes. We see that becoming a very big problem postpartum when you have to try and break that habit. Not to mention it does put a lot more stress on your back and shoulder to decrease in your form with those exercises. So you can switch to a power snatch, you can switch to a hang clean, a power clean. There's lots of modifications for those exercises. A burpee becomes a problem because your belly hits the floor. It's not ideal, also not comfortable. So my personal favorite was to elevate the burpee. And you can do the jump as long as you can. As that becomes too much impact, you switch it to a step in and out, and you're still gonna get that heart rate up. Jump rope, it does cause increased weight and pressure on the pelvic floor. That's that impact. It's similar to running. When you start having pain, pressure, heaviness, leaking, modify. Use a different form of cardio. Rowing, biking, walking, elliptical, any type of cardio you would like. Squatting becomes a problem because you start to have increased pain on the pelvis, on the pelvic floor, on that SI joint. You're not able to maintain good form below a certain point. A lot of times you can squat throughout pregnancy, but because the belly gets in the way, you might have to decrease the depth of your squat, decrease the weight that you're lifting, make it a tempo squat. It's going to be just as hard as having that heavier weight. Deadlift, kind of a similar phenomenon. Your belly gets in the way as you're going down deeper, so you might have to raise that starting point. If you push through it, you lose your ability to maintain lumbar stability because you get that rounding to try to get around your belly. That can cause back pain. That can cause problems later. You also might end up with pelvic heaviness if you're lifting too much weight. So increasing the height of your start, decreasing your weight. Sometimes a sumo deadlift or spreading your feet apart wider can make it so that you actually can get a little bit lower because you're making room for your pregnant belly. Planks, we want to watch for any doming or coning. That's the signs. People talk about diastasis recti. If you're seeing that little cone or dome, you are putting increased pressure on the linea alba, and it might be best to modify. That said, we do want you doing core strengthening and stability during pregnancy, which that used to be something people said to take out, and that is not true. But there's lots of other ways to strengthen your core, and that can be with a pale-off press, a side bend, just a transverse abdominis contraction. So there's lots of different modifications to keep you active, but there's also lots of instances that you might need to modify to set yourself up best for postpartum during pregnancy. So all that to say, can we exercise too much during pregnancy? We don't know. That's not something that we can ethically research, for one, but what we do know is that at 90% of your VO2 max, there is decreased uterine blood flow to the uterus. That said, my recommendation for pregnant women is make sure you can breathe. There is a time and a place for Valsalva. Pregnancy is not one of them. Early postpartum is not one of them. We want to make sure you're getting enough oxygen to the muscles, but you can exercise hard. There aren't heart rate limitations, but you do need to be able to breathe. I tell all my patients, you have to remember that pregnancy is a phase of life, and a lot of what you're going through is out of your control. So the biggest goal of exercise during pregnancy is to maintain a certain level of athleticism, but to set yourself up for a good postpartum recovery. On to postpartum.
Yes, so the postpartum period, just like Kirsten said with pregnancy, early postpartum is a phase. Postpartum is forever, but so a lot of this information that we'll talk about here can apply even if you've had babies years and years ago. But early postpartum, we really want to, set yourself up to be able to return to everything that you want to do. So number one, it's going to be slow. It's going to be tedious. There's going to be some boring exercises to start with, but we've got to re-educate this core stability system to work properly before we go into the more advanced and more intense exercises. So that being said, many factors will influence exercise postpartum. It will influence how quickly you can get back to exercise, which exercises that you're going to start with. And a lot of these factors are out of our control. The type of delivery, you could have had a perfect pregnancy and, through no fault of your own or anybody's, something happened during delivery, and now it's going to take a little bit longer to get back. How much you were able to exercise during pregnancy. If you were sick for 9 months, surely you weren't exercising as much as you were before you were pregnant. So that's going to influence how fast you get back and how you get back. The limited time, energy, and sleep you have with a newborn is huge. So we'll talk a little bit more about that shortly, but housework, childcare, are you breastfeeding? Are you getting adequate rest between workouts? Do you have equipment at home? Maybe you can't get to a gym because you don't have childcare. Workout partners, maybe you're used to working out with a group or running with a group, and now you can't do that because you're not at that level yet. And so how do you find the motivation to do it on your own? So everyone is different. Everyone will return at a different rate and often with different exercise. And every pregnancy is different, even within your own body. So you can't even compare your second pregnancy to your first or your third to your second. It's very individualized. And like Kirsten said with pregnancy, you will get back. It's just going to take some time and an individualized plan to get there. So I mentioned sleep. Sleep is huge. There are over 800 studies on the relationship between sleep and injury, and this is aside from postpartum and pregnancy. Just sleep in general for recovery, for healing from an injury is super, super important. So we know that low quality and quantity of sleep will lead to poor reaction time, decreased cognitive function, and insufficient recovery. In this study, the second study, they said 75% increased risk of injury with 6 hours of sleep or less, and then a significantly decreased amount of injury risk with 9 hours of sleep. But I don't know any early postpartum moms that are even getting 6 hours of sleep, let alone 9. So we just need to really consider that and give yourself a lot of grace when it comes to sleep. Try to get your rest when you can, and also be aware that even later on down the road, maybe your baby is 6 months, 8 months, 9 months, a year old, and they just have a really rough night of sleep. So you have a really rough night of sleep. That next day may not be the best day to try to PR a lift or to try to run your longest distance postpartum. We need to adjust our workouts based on how much sleep and recovery we're getting. So when we are retraining we call this core stability system. This is kind of some of the research that we're using to back this up. So the transverse abdominis is your deepest abdominal muscle, and the fibers run this way across your belly. And then the diaphragm, of course, is right up here at the top of the core, and the pelvic floor is at the bottom. So these studies showed that the transverse abdominis and the diaphragm and the pelvic floor are contracting preemptively before any limb movement. So in the first one, they had someone moving their arm like this. And they showed that, and they had, the EMG on the transverse abdominis and on the deltoid, and the transverse abdominis and the diaphragm contracted before the deltoid or any shoulder or elbow muscles. Same thing with the pelvic floor. The pelvic floor activates before a straight leg raise when we're lying down. And then more recently, they've shown that the pelvic floor precedes heel striking running, or contraction precedes heel striking running. So all this to say that these muscles should contract automatically, like I mentioned before. We shouldn't have to think about these muscles contracting. They should contract automatically to stabilize the system for us then to be able to move efficiently. So how do we retrain these muscles? Because it gets all jacked up during pregnancy. So I mentioned the diaphragm is the top of the core, the pelvic floor is the bottom, transverse abdominis is the front, and the multifidus, the deep low back muscles, are the back. And we want to think of this as a soda can, or Julie Weeb describes this as a piston. So when we inhale, the diaphragm is going to descend and the pelvic floor is going to relax or lengthen. When we exhale, that diaphragm will recoil and the pelvic floor will contract. The same thing happens with the abs. When we inhale, they should relax and bulge a little bit, and when we exhale, they should contract. So we want this system working well, working automatically, working together efficiently first. And like Kirsten mentioned with the postural changes during pregnancy, when our ribs flare, our diaphragm and our pelvic floor are no longer working together like this as well. Our abs get stretched, and so they don't have the tight connection they're used to having. The low back, we posteriorly shift our ribs, so our low back muscles get kind of out of whack too. So the first goal postpartum is getting all of these muscles working well together. If we don't get this core and foundation set, then it can create problems elsewhere in the body: hip pain, knee pain, shoulder pain. We mentioned low back pain, but a lot of times with those types of injuries, we don't necessarily look at the pelvic floor, but we should, because that core system needs to be working well first. It needs to be strong. It needs to be coordinated, like I said. So oftentimes I'll describe this as, you want this to be strong just like if you were jumping off of a dock. So if you jump off a dock, that dock is stable, it's strong, you can really get distance. But if you're jumping off a floaty raft in a pool, you're just going to flop forward. You're not going to get any distance because your base isn't strong. So how do we intervene here? The first thing we like to do is work on breathing. So lots of people that we evaluate have what we call reverse breathing patterns. So what we want to see when we inhale, the diaphragm descends, your belly relaxes, and the pelvic floor relaxes. So you should be able to feel on an inhale your belly expanding. You should be able to feel the pelvic floor relaxing. And then on the exhale, the belly and the pelvic floor should come up and in. A lot of times what we'll see is an inhale, and people suck in their bellies and raise their chest, and exhale the opposite way. So that's what we want to change. So you can practice this in standing, you can practice it in side lying, laying on your back. Some people find it easier laying down, some people find it easier sitting. It's all very individualized, but this will usually be the first thing that we'll assess. So then, once we get that inhale, and oftentimes we need to work on the inhale first. So a lot of times people think their pelvic floor is weak, maybe that's why they're leaking or having pain or heaviness and things like that. But if that pelvic floor is overactive and tight, then you can't get a good inhale, and you most definitely can't get a good contraction. If it's already at its in range, you're not going to be able to feel that lift. Just like you wouldn't do a bicep curl from here. You've got to let that muscle relax to then contract. So when we think about the pelvic floor, we want to focus on inhale to relax. So you want to allow those muscles, allow your sits bones to kind of spread, allow those muscles to relax, as well as the abs. You want to let those muscles relax, which is very hard. We've been trained our whole life to suck everything in and hold everything tight. And we see this particularly with athletes because they're so used to just grip and hold and everything's trying to be strong and stable, but in reality, these muscles have got to relax first. So we teach the relaxing and then work on the contracting. So we want to think of the pelvic floor contraction as a close and a lift, not necessarily a squeeze, because we don't want to facilitate a bearing down of the pelvic floor, but a close and a lift. And then the same with the abs. You don't want to bear down or build your belly out when you're activating them. You want to draw them in like a corset. We get a lot of questions about diastasis recti. So this is what Kirsten mentioned when the abs, the rectus abdominis, your most superficial ab muscles, kind of split during pregnancy. It's a widening of the linea alba between those muscles. And this is going to happen in all pregnancies. It has to, because we have to make space for the growing baby. This study showed that 36% of them will remain wide at 7 weeks. And then they showed that for those that still had it present at 8 weeks, it was also still present at a year. While it was narrower, it wasn't all the way closed. However, I do want to point out that in this study, they didn't do any intervention. This was purely observation. So what this tells us is that we need to intervene here. We need to do some intervention. It's not going to always naturally come back together on its own, but it can be strengthened. If you've ever watched your baby or a kid try to kind of do a crunch or sit up, they get the doning and the coning and the toning because their abs aren't strong yet. So, but we don't tell them to not do sit-ups, you know? So not that sit-ups are always the answer, but there's needs to be some very targeted abdominal strengthening to help to close that gap. And what's even more important is that the transverse abdominis underneath your rectus abdominis is tense, and that muscle has good stability. So we will check these things when we have a patient coming in postpartum, and then give them guided exercises to help increase that tension of the transverse abdominis for stability, and also help to start to close that gap. So once here's some videos of some exercises that we start to prescribe after we get that core stability strategy working well together. So once we've got the core floor and the abs working well, we start working on movements on top of that. So you have synergies in your body. One of them is the posterior oblique synergy. So this is your lat and your opposite glute max, and they connect through the thoracolumbar fascia and your lower back. So they help each other out. So when we are trying to get that glute fired back up, because maybe during pregnancy it's been tucked under, we want to really start working on the strength there. It can also help pelvic floor function. We'll pull in the lat to help facilitate that glute strengthening. So this exercise is called prone X's. So Kirsten has her arm, she's laying on her stomach, arm up kind of like a Y, and then her opposite leg is abducted or slightly out to the side, so it makes kind of an X through her body, and she's working on the exhale. So if we exhale before a movement, we're going to kind of prep that system to stabilize. So you would inhale, exhale, and then as you're exhaling, you're bearing down with your arm to engage the lat and kicking up with your foot to engage the glute. Technology. All right, the next synergy is the lateral synergy. So this is the glute med, which is your outer hip muscle, and the opposite adductor or inner thigh. This synergy is super important, particularly for leaking during exercise. So we can do that. We can strengthen this synergy with quadruped fire hydrant. So you're on hands and knees. The knee that's closest to the wall has a band around the inner thigh, and she's engaging that inner thigh, pulling against the band with her right leg, and then doing a fire hydrant or an external rotation, abduction movement with her left leg to work on that glute med. And then a third synergy is the anterior oblique synergy. So this is the obliques with the opposite adductors, and these muscles run right across the abdomen. So creating strength, and this synergy can help create tension through the abdomen to help re-strengthen those muscles. So in half kneeling, she's pulling with her right arm down and across, engaging those obliques on the right, while also consciously thinking about pulling her left knee in towards the other leg slightly to engage those abductors.
Okay. All right, moving past the synergies to a little bit more treatment strategies. One of the things we focus on, we've talked about a ton, is the postural awareness you lose while you're pregnant. We need to regain that. And that said, a lot of people lose postural awareness whether or not they're pregnant. So a lot of these are good for women or individuals throughout any stage of life. But where I like to start is getting that rib cage back over the pelvis. So let's go back to that pregnancy posture I was talking about before. You're often all the time here. So I like to try to make you do a forward lean or a ski posture. So you can't see my ankles, but from this one, it's like you'll lean from your ankles. So you're not bending from your hips. You're trying to get in that forward lean position. Oftentimes, this automatically brings your rib cage down and does a better job of stacking the rib cage over your pelvis. I'll have patients just breathe there, and that will try to encourage refinding the position in which your rib cage is stacked over your pelvis. Again, we need to find that first. Let's get the diaphragm working with the pelvic floor to try to start to set up that automatic response. The other thing I see during pregnancy or in general is a lot of people will stand in their heels. They're shifted back in their heels. So I want you to try to find how can you get your weight in your midfoot. And a lot of times that lean forward will help you find more of that centered position with weight throughout your entire foot. Another thing I see people lose is rotation. So during pregnancy, you're guarded, you're standing in this position, you often are not rotating. Your rotation is limited because of your belly. So I want to encourage as much rotation as possible during postpartum recovery. One of the exercises I love to do is a Spider-Man crawl, so it's a variation of a bear crawl, but you're getting more hip extension. You're actually letting your body rotate as you're crawling. And that said, you actually can't get full hip extension if your body is not rotating like it should, with running, with walking. So it's like you have to have thoracic rotation for rotation stability, and for that I love this exercise. Another thing I see people not use postpartum is arm swing. You're so used to guarding, your whole body braces. You're not doing rotation, so your arms are not moving. So adding in arm swing will help your core actually work better. Research has shown that exercises that incorporate an upper body and a lower body component actually help you to activate your core better. So it's like if there's a way to throw in an upper body component to a lower body exercise, we're gonna do it as much as we can to activate that core system. One of my favorites is the split squat with an arm swing. So you're strengthening your glutes. It's a very runner-specific position, but it also is using some of the synergists Amanda talked about. It's like we've got the glutes working. You can try and use some of those lats as you're pushing up with the glute. Your arms are pulling back with your lats. It's like add an arm swing to as much as you can. A huge basis of our treatment is breath mechanics, is breathing. We've mentioned it how many times in this presentation. There's many ways to incorporate breathing into exercise. A couple of the ones that we might use is blow before you go. So I know Amanda was talking about, sometimes you'll focus, get that good inhale, start your exhale, then do your movement. This helps provide you, and this is often a very beginner level one, so that early postpartum stage, that relearning where your body is in space, let's create as much central stability as we can, so that when you're getting up from the couch, when you're rolling over in bed, when it's an activity that often causes leaking, can we do that blow before you go strategy and see if that fixes the problem? Exhale on exertion, that one is more commonly known. You're going to inhale on the way down into a squat, exhale on that harder portion of the squat. Again, providing the pelvic floor and the core with as much stability as possible because of the breath mechanics we've already talked about. Inhaling through the movement, and that might be more for the individual who has a lot of pelvic floor tightness. They can't get their pelvic floor to relax. They can't get their abdominals to relax. We need them to inhale through the whole thing. They don't need help with that exhale exertion tightening pattern. Just breathe. During pregnancy, during postpartum, make sure you're not holding your breath. Breath holding is a common technique people use to create core stability, and it does create core stability. That's why Valsalva is a thing with heavy weightlifting, and there's nothing against that at a certain point. But during pregnancy and early postpartum, that's not what we want to do. It's like we want to make sure you're breathing. We want to re-coordinate that system so that one day you can get back to Valsalva. But for the exercises that are not one max lifts, it shouldn't be something that you're using. I think you have to use there we go. Technology. So, single leg strengthening is another thing I like to use with a lot of my postpartum athletes. It's a good way to see imbalances, but also it's like you don't get to spend as much time on one leg during pregnancy. In general, we don't spend as much time, and it's a great way to see where those imbalances might be, and those muscular imbalances can put increased stress on your pelvic floor, on your back. Without having that balanced system, there might be issues elsewhere. So you can do single leg varieties of a lot of different exercises. I love single leg squats. I love single leg RDLs, which there's a video here. I love side step taps. You have to stabilize a lot more through your hips and your core for a single leg exercise than you do with a double leg exercise. A slow reverse step down is another one that I like. These might not be super early postpartum. These are progressing to that single leg stability. So I like to start with staggered stance and then progress to single leg and even add rotation on that single leg as you can to get as much functional movement and stability as possible.
Gotta pause it.
Videos are great. And that's it. We have a lot more videos on our YouTube site. So here's a couple more we like to use. This one is just on your back. We're getting a little bit of that oblique activation with a ball squeeze. So you're getting that opposite adductor at the same time. So that's back to the synergist. That's more of an entry level exercise. And here's the slow reverse step down that I just talked about as far as when we're working to that single leg and we have some single leg stability. And this is an exercise that we like. That's the link to where we have filmed, I think, 15 or 20 different exercises we like to use with our pregnant postpartum women. Also, it's not advised to just go do them all. It would be better for you to see which ones would be necessary and more specific to you, but there is access on our site.
One more time. Sorry.
We're good. Good. So let's talk a little bit about returning to run postpartum. This is an area that they have done some more recent research on things they recommend you be able to do prior to returning to running in order to decrease your risk of injury. The injury risk is always there, but it's going to be safer to return once you can do these lists of things versus just going out running at 2 weeks postpartum. So you should be able to do all of things without any symptoms. So you want to make sure you're watching for pain, you're watching for heaviness, any type of leaking or incontinence, and then you can start an interval program, which we'll talk about in a second. You don't want to just go run 3 miles. There is a lot of research on these, but also it's expert opinion. So everybody's return to running is going to be a little bit different. It's not you meet the checklist and you're ready to go. There might be other imbalances that we find as physical therapists that might need to be addressed first. But in general, we want you to be able to walk 30 minutes. We want you to be able to balance on one leg, 10 seconds on each side. Can you do 10 single leg squats on each side? And that's not necessarily a pistol squat, but can you do 10 single leg mini squats without symptoms? We want you to be able to jog for a minute in place without any symptoms. Forward bounding, so that's more of just with your feet together and you leap and land at least 10 times. Hopping in place on one leg, and we hop 10 in a row. Single leg running man is what we call it, so that's a higher level version of balance. Can you stand on one leg and you're coming hip flexed to extended, there's a wall there, back and forth, at least 10 on each side. All of these things we want you to be able to do without any symptoms, pain, leaking, heaviness. Strength-wise, we also want you to be strong. Running, any impact exercise has a lot of pounding on your joints. I want those joints to be able to stabilize enough so that they're not just taking in the joint and muscles are doing their work. So can you do 20 single leg calf raises, single leg bridges, single leg sit to stands, sideline hip abduction. Make sure those hips are super strong, the calves are super strong before you go out and run. Different cues you can also use, or different strategies you can use when you return to running to make it a little bit easier on your pelvic floor. Most people don't think about running uphill and walking downhill, but that actually is a better way. You're going to lean into an uphill. So can we get that ribcage over your pelvis? You're more likely to be in a good position versus downhill. A lot of times I've seen people break putting your pelvic floor in a weaker position. So I start my postpartum runners, if you're not in Virginia Beach and you have hills, running uphill and walking downhill. Intervals, we're going to talk about that in a minute. We're not going straight to running 2 miles. We're going to start you more at a jog walk program. I also recommend you build volume before intensity. Sprinting, running fast requires a lot more muscle activation, a lot more stability than that volume that we want to have to keep you safer. So Amanda will talk a little bit about intervals.
Yeah, so just like Kirsten mentioned, we want to start with a run walk. We do this for a number of reasons. It helps our muscles to have a little bit of recovery time in between those run segments. So we can often do a longer workout than if we just went out and just did a straight run. You're also going to start building your endurance back up, you know, that probably decreased over pregnancy. And so we want to work all systems of the body on these intervals. There's lots of recommendations and different types of intervals you can do. We have 3 examples here. So this one is the most recent study done, and it actually was done on postpartum women. And it starts with a 1/4 mile walk, a 1/4 mile run, 1/4 mile walk, 1/4 mile run. So total of 1.5 miles weekly. So they have you do that, and they're only counting the running miles here. So obviously you're covering more ground than that. And if you're doing it 3 times a week, that would be your weekly mileage. And then it's very slowly increases the run distance. So by like 0.03 or 0.02. So it's very, very gradual, which for some people might just be perfect. For others, starting at a 1/4 mile run might be too much. It was for me when I was coming back to running. So there's some other options too. But again, very individualized, and this is one option that will get you over the course of a few months returning to fully straight running. This one is a little different in that it starts with a 0.1 mile walk, 0.1 mile jog. So it's a decreased distance that they're starting with for running. I'll often give this one and also say you can do it for time. So like instead of 0.1 miles, replace that with 1 minute. Instead of 0.2 miles, replace it with 2 minutes. It doesn't equate perfectly, but it's pretty close. And this wasn't specific to postpartum. This is just coming back post-injury, which I recommend to anyone that has had an injury and has been out of running for a period of time to start back with intervals. So just take that with a grain of salt. This isn't specific to postpartum, but still helpful. This one gets you to running 2 miles straight and then starts building the mileage from there. And then this one is a little more conservative with the run walk intervals. It starts with a 1 minute run, 3 minute walk, and you do it 10 times. So it's a longer total duration of a workout, 40-minute workout. And you stay kind of in that 30-ish minute range of the total workout all the way through, I guess you go up to 42 minutes, 6 minute run, 1 minute walk. And then you start building a little more distance and you ultimately get to a 9 minute run, 1 minute walk, but you're moving for an hour. And then, you're ready to do a 45-minute straight run. Again, not based on, this wasn't with postpartum runners, but developed by Chris Johnson, who is a highly acclaimed physical therapist who treats runners and triathletes. Turn back over to Kirsten.
All right, so let's talk a little bit more about different cues you can use with running to try to decrease your risk of injury. Similar to how I was talking about running uphill, that cue can also be running into the wind, lean a little bit forward. I hesitate with lean forward sometimes because I don't want this, but it's like you want to lean into it with the goal of let's get your rib cage stacked over your pelvis. Another thing I tell people to keep in mind is where you're looking. So your body's going to follow your head. So if you're looking up, you often see that rib flare, and I see people running in this position. So if you look 20 feet ahead towards the ground, your body will follow. And you get the forward lean that way. We want a faster cadence. That's been proven by multiple research studies to decrease the stress on a lot of your joints and your body, with the end goal oftentimes being 180 steps per minute. Everybody's different. But if you're starting at 130, 140 steps per minute, we're not going to make the goal 180. We want to increase about 5 to 10% and kind of go from there. Relax your shoulders. I see people tense while they're running. You can't breathe in that position. So breathing comes into running. It's like we want to be able to relax your core, get a good inhale, get a good exhale. Arm swing. Don't hold your body stiff. Let's get your rotation. Let's let your arms swing and rotate while you're running. Again, don't hold your core tense. Focus on breathing. Of course, you're not exhaling every time you're landing or even like using the exhale for something specific the whole time you're running, but you need to be breathing. Impact, very similar to running. There's lots of different ways to get back to that jump rope, that box jump, but it starts very gradual during that postpartum period because impact activities are very high stress on your joints and on your pelvic floor and oftentimes linked to urinary or fecal incontinence. So we will start with most patients with breathing when you land. Can you exhale as you land to give that pelvic floor and core a little bit more stability and maybe decrease that risk of leaking? Drop hops would be next. And this is another progression that it should be more individualized. But in general, it's like we're going to use the breath in each step. We're going to gradually increase the amount of force you're feeling. We're going to probably, if it's pelvic floor related, probably go more from single leg impact to that double leg. Jump rope and double unders are very high levels of stress to that pelvic floor. So kind of in summary, when you're returning to sport from postpartum, it's very similar to talking for a long time. It's very similar when you're returning to sport from an injury. There's lots of things to consider as you're getting there. There's lots of ways to modify as you go. We want to make sure you're watching for symptoms during each progression towards full activity. So if you're having symptoms of urinary incontinence, anal incontinence, any symptoms of pelvic organ prolapse, which that can be that deep abdominal ache or feelings of heaviness or bulging. If you're having any increased bleeding, and that's mainly very early postpartum, or if you're seeing any doming or coning along the middle of your abdomen, across that linea alba, you might need to take a step back. We might be going too fast. Or we might just need to try to modify your breath. There's lots of different things to try, but we don't want to be feeling those symptoms as we're going back. They might slow us down in the long run and make this phase of recovery a lot longer than it needs to be, and we want to set you up for success. Remember that there's many factors that influence how quickly you can get back to sport or activity. Don't compare yourself to Instagram or Facebook where you're seeing these people bounce back. You don't know what they're feeling. There's no such thing as a quick bounce back. It's like you want to be stronger. They might be having the pain or the feelings of leaking and you would never know about it, so don't listen to those. It's like do it correctly. Your mode of delivery, the biopsychosocial factors. Sleep was a huge one. All of that contributes to how quickly you can get back. Also, what sport, what activity are you trying to get back to? The pelvic floor needs to be trained differently. For long distance running, you need endurance in those pelvic floor muscles. For heavy lifting, you need strength in those pelvic floor muscles. It might come back quicker or slower depending on the pregnancy or the person. Also, were you able to train during pregnancy? If you were not, that would almost like be coming back after 9 months of not doing anything. And that would require a slow build-up phase regardless of whether or not you were pregnant. General recommendation, start with low loads, low impact. Progressively load while monitoring your symptoms, managing the pressure in the intra-abdominal region, manage your fatigue, make sure you try to get some sleep, and you will get there. Remember, it's a phase. That's like just like pregnancy, postpartum is a phase, and you want to be good to yourself and set yourself up the best way you can for success. We recommend, I would love it if everyone postpartum got to come see a pelvic floor PT in the first 2 to 6 weeks, even before you're cleared. We can start postural awareness. We can start breathing. Lost it. We can start breathing, start recreating that automatic response to set yourself up great so that when you are cleared by your doctor, that you'll be ready to start some basic exercises, because you're not often given any guidance when they clear you at 6 weeks as to where to go. And we want to set you up so that you don't end up hurt by doing too much, but also that you have more postural awareness, more ability to breathe correctly when you get there. So especially if you're 12 weeks postpartum or less, we recommend seeing a women's health physical therapist. Any leaking, any pelvic pain, any heaviness, come see a women's health PT. Back, hip, or knee pain that won't get any better with the typical orthopedic treatments, especially in a mom. There might be a pelvic floor component. We recommend you see a pelvic floor PT. So that is all we have today, which is a lot, but also only the basic information on so many things. So if you have any questions, please reach out to us, email, text. We want everybody to have this information, so start talking about it and spread the word. Thank you for listening.